Today we're all gathered here to talk about young people's mental health. I'm delighted to have an amazing panel and also to introduce our newest MQ ambassador, Gemma Stiles, who's going to be hosting this evening. I'm going to be here encouraging you to tweet in the background and hopping on at the end, but I'm just going to hand over to Gemma to host and introduce our guests. So Gemma, over to you.
Thank you, Daisy. I'll remember to unmute myself before I start talking. Good evening, everyone. Thank you very much for joining us tonight. My name is Gemma, and as Daisy said, I'm the newest MQ ambassador. So this is my first time hosting an event for MQ, and actually, like a few of us on the panel and hosting tonight, first webinar, so I'll try and best for you. I just introduce why are we talking about young people's mental health. 10% of children and young people between the ages of 5 and 16 have a clinically diagnosable mental health problem, and yet 70% of children and adolescents who experience those problems have not had appropriate interventions young enough. The situation over the past year, obviously talking about the pandemic they're currently still living through, losing access to friends, not going to school as much perhaps. There are important social supports that have perhaps been lost. Studies have been impacted, the job market's been impacted, so it's obviously been a really difficult time for everyone, perhaps particularly young people as well. Young people's mental health has been a particularly urgent priority before the pandemic. Early intervention saves lives, and MQ have been funding research into young people's mental health since it was founded in 2013. So your panel for this evening are 3 fellow MQ ambassadors, Professor Anne John, Dr. Jean-Baptiste, Pingault, and Deepanshi. So I'll just ask them to introduce themselves and their work to you. If I could start with you, Professor Anne John.
Thanks, Gemma. I'm Anne John. I'm a professor of public health and psychiatry at Swansea University, and my research focuses particularly on young people's mental health, and then on self-harm and suicidal behaviours. And with MQ, I lead on a project called the Adolescent Mental Health Data Platform, which is really about bringing researchers and data to transform particularly young people's lives.
Thank you. And Dr. Jean-Baptiste Pingault.
So hi, I'm Jean-Baptiste, and I'm an associate professor at University College London, and my work is on child and adolescent mental health. So my research focuses more on the origins of mental health difficulties, and in particular understanding the biological and environmental early risk factors that can lead children to develop mental health difficulties, either in childhood and adolescence, but also later in life. And MQ has funded one of my research projects, and I was a fellow for over 3 years at MQ working on bullying victimization, and I think we will talk about that a bit later on.
Thank you very much, Deepanshi, finally.
Yes, hi, I'm Deepanshi. I'm the founder of Rain on Me. I started Rain on Me in 2018 after living with anxiety, OCD, and ADHD for more than a decade. And Rain on Me, basically, we provide a safe space in the form of support groups for individuals in a position similar to myself who need to vent about daily struggles and stresses affecting their mental health. I am an ambassador for MQ. And since starting Rain on Me, I have also become a youth and adult mental health first aider. I'm about to start my master's in psychotherapy, and I'm currently studying therapeutic arts. Thank you for having me.
Thank you very much, everyone. So to kind of start this session with a more basic question, if you like, why is research into young people's mental health so important? And if we could start with you, Anne.
So in some ways, with the stats that you talked about, you highlighted why it's so important. So most mental health problems start when people are very young, and those mental health problems impact on their relationships with people, how well they do in school, so their whole life trajectories really. And I think it's really important, one, to understand why that happens, so the sort of research that Jean-Baptiste does, but also, you know, what happens to people, who are they, when's the best time for us to intervene so we can interrupt those trajectories to improve people's lives, basically. And I think starting when people are children and young people has an impact across the whole of life, really.
Yeah, absolutely, intervening in those kind of formative years. So same question, why is it so important? Jean-Baptiste?
So I think Anne said it quite well already. I think if we want to talk about particular disorders, we know that some disorders will emerge at different stages in life. For example, if you take autism, like we know that it's in very early years that children get diagnosed with autism, and at the other extreme, you have something like maybe schizophrenia, where it's usually diagnosed only in adulthood. But even for diagnoses that happen only in adulthood, like schizophrenia or bipolar disorders, often you have like symptoms that emerge much earlier in life, and therefore it's like basically what it means is that like most mental health disorders either emerge in early life or have their roots in early lives, and so it's really important to understand these roots and then to try to intervene early on to potentially, as Anne said, change this trajectory. And even if we don't always have like adequate treatments so far, we can at least try to accompany the people and support people as well as we can to help them basically better live with the disorders that they have. And that needs to start quite early in life, basically.
Yeah, absolutely. And finally, Deepanshi, which I suppose this might be a slightly more personal from the work you do with your organisation. Why people's mental health so important in your experience?
Well, yes, it is. This topic is very close to my heart, of course, and I think there are a lot of treatments out there, but the thing is that exactly that they're treatments. They're not a cure or a prevention per se. And I believe mental health is much more complex than physical health, as every individual is different with many layers of emotions, and so it's sometimes difficult to really identify what the person is struggling with. And as I mentioned, I have personal experience when I was diagnosed. Instead of a spectrum, I was put in a category or a box. And there wasn't much human interaction involved there. It was mostly a questionnaire. And I'm not saying this to blame the psychiatrist. I don't think it's their fault, really. I think it's the whole system that needs to be remodeled. And yes, we need more treatments, but I think what's more important is research on what leads on to, an individual's ill mental health and how to fully recover from that. And so we can prevent it from the start by putting support systems in place. And as you mentioned, this starts from a very young age. So if we can start from that time, we can avoid an adult life of suffering and feeling misunderstood because of their mental health.
Absolutely. So speaking of research and how we start to understand these things better, and you lead on the MQ funded adolescent data platform, as you mentioned earlier. Are you able to tell us a bit more about that and what we think the potential might be?
Muted, sorry. So the ADP, as we call it, is a platform where we bring different data sets and people, researchers together. Now, often when you're working with, so often as researchers, we work with data that gets specifically collected for a project. Where the ADP is really useful is it uses the data that gets collected, you know, as we go about our day-to-day lives. So it's sort of like the records that get generated when you contact health services, if you you know, see your GP, if you're, we can also link across different data sets. Now we have lots of you know, privacy protecting procedures that, you know, all the data is anonymized, because otherwise people do really worry about their privacy. But this sort of data that's sort of, you know, it's on lots of people, it's entered by lots of people, it's really, really messy. But it generally includes everyone. So when you think about most studies, lots of people with mental health problems, they don't want to take part. And so what I like about this sort of data is it does give everyone a voice. But it can be complicated to work on. And so what we do at the ADP is we have lots of algorithms and code lists, sorts of things like that, that really support researchers to ask the questions that they want to ask.
And what do you think we can achieve by using this kind of data-driven science as opposed to other kinds of studies you mentioned where people maybe volunteer for the studies themselves?
So I think the sorts of studies that we call cohorts, where people sort of sign up and, you know, they might, you know, things will be, they'll be asked things that will be recorded. What we find is that often people with mental health problems aren't represented well in those studies unless they're about mental health. They tend to, you know, if you were following people up for 10 years to see what happened to them, you know, to see all that stuff about what were the factors that happened when someone was a child that led to mental health problems later. Often the people who are most unwell will not stay in follow-up. So what that means is that there's lots of people with mental health problems that just aren't represented well in research. And I think what I feel passionately about when I'm thinking about routinely collected data is that they're there and they have a voice, and we can really see, we can understand lots and lots of different factors that impact on someone. So at the moment we've done a project where we've linked pupil data, so absences and exclusions from school, to primary care, GP and hospital data. And we've demonstrated that children with mental health problems are much more likely to be absent or excluded from school. And that's almost, it's what we call transdiagnostic. It almost doesn't matter what the diagnosis is. You know, there's a little bit of increase and decrease. So, and it changes how you look at young people then, because those who are excluded and absent, you can see that they're vulnerable and in need of support.
Thank you. And as you mentioned, you know, people can be a bit tentative or a bit worried about their data being used. While we're here, would you be able to elaborate a little bit on where the kind of variety of data sets that you pull from and how that data is anonymized?
So I remember going to the Young People's Advisory Group, MQ's Young People Advisory Group, and I had all this stuff in slides to talk to them about, because I thought that they would find the whole anonymization of data bit really boring. And I got asked so many questions about it. So basically, the way people can consent for their data not to be anonymised. Most routinely collected data is anonymised, and what happens is that the identifiable data, the stuff that says, you know, your name, your address, that stuff, gets split off from all the other data and sent to what we call a trusted third party. So that's usually the NHS. And the NHS takes that identifiable data and gives it a key that we call an ALF. And then the data over here has another ALF on it. And so over here with those ALFs, people have the same ALF in different data sets that we can connect, but we never know all that identifiable stuff. And, you know, so I could tell you that's what I'm doing. There are a million different checks and certifications in the sorts of systems that things like ADP sit in that mean that the data is anonymised. The researchers are trained. We work in remote environments, so the data never comes, the data's on a remote desktop. I never have it in my computer. So there's lots of safeguards and protections to keep people's data anonymised. It's, you know, it's hugely important.
Great to hear, thank you. I definitely just asked you to explain something very complicated very quickly, so thank you for that overview. To move on to a slightly different area of research, perhaps, Jean-Baptiste, your MQ funded research is about bullying and mental health in young people. Could you tell us a bit more about your research and what it could potentially mean for young people?
Yeah, so before I do that, I will launch a polling right now, and hopefully you can see it. You will find the questions a bit curious. It's like just 3 questions, but just like respond to it without thinking too much about it. I will give you like 30 seconds. Kind of cool because I can see the results coming in directly.
I have done.
Okay. Almost everyone has answered. Okay, so I'll come back to these questions a bit later in my presentation, in my response to that question. So the first objective of my research was really to look at the impact of experiencing bullying on mental health in childhood and adolescence, because we know that bullying is very prevalent, and so most children and adolescents will experience directly bullying at some point, or at least indirectly by witnessing some form of bullying. There is even a survey a few years ago in England showing that 55% of 15 years old had experienced bullying fairly recently. So it's a very prevalent problem, and it has been clear from association studies that bullying can be associated with really negative outcomes. And so that's the second question, and like most people have identified it right, meaning that bullying victimization, even during childhood, has been associated with very long-term poor outcomes, including even things like poor mental health, but also lower education and lower well-being and all these things. So it seems like that bullying has a kind of important impact on mental health and other outcomes. But the key question here is the question of causality. And a lot of you, at least those that have done like some study in psychology or are interested in mental health or like science in general, might have heard the mantra that association doesn't equate causation. And the fact that things are associated together, so they relate, it doesn't necessarily mean that one is causally impacting something else. And so that was like the aim of the first question about food size and vocabulary size. And it's a question I always ask my students, and most of them get it wrong. And here 90% of you have said that they are not associated, but in fact they are associated. And it seems a bit ridiculous because obviously there is no link between how big your foot is and the number of words you know. But it's quite simple to understand. Like, think about babies. They have tiny feet, and they also know like not many words. And then adults, they have big feet and they know many words. And so if you look in a population study, you will actually see that there is like an association, and a strong association, very significant association between foot size and vocabulary size. But obviously, this association is not causal. So when you answered no, what you did implicitly is you answered the question, is foot size causally related to vocabulary size? And the answer here is clearly no. So don't try to like increase the foot size of your baby to make them learn more words, because you might get a bit into trouble and it will clearly not work. So the key issue here is to be able to distinguish between the causation and the association. And so that was the aim a bit of my project with bullying. And in order to do that, what we did is that we looked at bullying and mental health in twins. And why in twins? Because in twins, we can look at one twin and see whether they've been exposed to bullying. And then we look at the other twin who, for example, has not been exposed to bullying. And because the twins are matched on many things, so obviously they have like the same, like a lot of the same environment, the same genes, etc. If one twin is exposed to bullying, and then if bullying is related causally to the outcome, you would expect that this twin will also experience more mental health problems. And this is actually what we observe. So like the twins who have been exposed to more bullying also have more mental health problems. And so this is a kind of scientifically a very sound way of saying that bullying does have a causal impact on mental health. So far it's not very original, because like intuitively we know that bullying might have like a kind of causal impact on your well-being and your mental health. But two findings that were slightly more original in this initial question were that first, bullying was not associated with everything. It was mostly associated with anxiety and depression, which kind of intuitively makes sense, because you would think, if you had to bet, you would say, like, experiencing bullying will definitely make you more anxious and is likely also to lead to more depressive symptoms, but maybe less to hyperactivity, for example, because the two seem intuitively a bit less related. And that's exactly what we found. Like the major causal impact was on anxiety and depression, and a few other symptoms of mental health, but not all of mental health. And then another aspect which was interesting was that the causal impact, as we've seen it in the twin studies, and other studies have also showed that the impact kind of decreased over time. And so like we observed the impact immediately, and then 2 years after, and then a few years after, the impact started to decrease. And so this for us was quite important, because we read that as a sign of the potential for resilience in people who are experiencing bullying. So in a way, if you are experiencing bullying, you will probably experience some anxiety and depression, but it doesn't mean that you have to experience that like during all your life. And at some point, you will have a process of resilience taking place where you will basically start to feel better. And I think that has impact for prevention, and that we can maybe discuss a bit later.
That's so interesting. I'm definitely going to use that vocabulary foot size example in the future. I can tell already. So yeah, how you were saying about you, obviously where you're able to establish causality, it's kind of then the natural question. So has there been anything that you've come across in your research, even more so than saying being able to prevent long-term negative impacts? Is there anything you've come across where you found the cause and prevention of the situation in the first place? Was there anything that you came across in that?
So one thing I didn't say in terms of to try to qualify a bit the impact of bullying victimization as we found it, it's like comparable in size to like the effect of earthquake or personal loss on post-traumatic stress symptoms. So in a way, it looks like it's an environmental variable, and it does have a kind of substantial impact on your well-being, at least on the next few years after you experience bullying. And in terms of prevention strategies, so far the prevention strategy in the areas of bullying, they kind of what we call anti-bullying strategies, in the sense that we try to first to stop bullying in the first place. And that kind of makes sense, because we've seen that if bullying has a causal impact on mental health, if you stop bullying from happening, then obviously you expect that it will have a beneficial effect on mental health. The slight issue is that these interventions, like on average, they prevent, let's say, about 20% of the bullying happening. So they can't prevent everything from happening. And because the effect of bullying and mental health is important, but doesn't explain all the mental health, because there are so many factors for mental health. What that means is that, like research has shown that all these kind of anti-bullying interventions, they have an effect on bullying, clear effect, about 20%, as we said, and they also have an effect on mental health, but the effect on mental health is actually quite small. And then that's again because we don't prevent much of the bullying in the first place, only 20%. And then the effect on bullying on mental health doesn't explain all the mental health, because there are so many other factors for mental health. And so the insight that we get for the research from the research that I did during this MQ fellowship is that we should definitely try to prevent bullying in the first place, because obviously first, like morally, it shouldn't be happening. So that in itself should be a good reason enough to try to prevent it. And also because we've seen that it does have an impact on mental health, but then in itself, it's probably not enough, and we probably need additional support. And so one important insight from this research is that in addition to these interventions, we probably need additional mental health support for the children and adolescents who are experiencing bullying, in order, in a way, to foster their resilience on the long term, and also potentially deal with other kind of vulnerabilities that they might have, and that might also lead to worse mental health outcomes on the long term. So we kind of hoping at present to develop like resources for children and parents and teachers to explain a bit these aspects, and make like people aware that obviously you need to deal with the bullying, but it's also important to have a support that doesn't stop at that and is a bit more in depth in terms of their mental health.
Gemma, could I just add something to that?
Absolutely, yes, please.
So I think whenever we're talking about bullying, so we did some work looking at cyberbullying and self-harm behaviours, and absolutely bullying made people more vulnerable to those behaviours if you were a victim, but also if you were a perpetrator. I really don't like the perpetrator and victim language, but I whenever we talk about bullying, I think I always want to go, these are children, and actually both sides of the coin, and online bullying is not as differentiated. People can often be both, either side, you know, across time or even in the same day. And I think the way to look at it is any child involved in bullying, it doesn't matter what their, you know, what side of that they're on, requires the sort of support that Jean-Baptiste was talking about.
Yeah, that's a really, really good point. And we're actually publishing another study looking at, in a way, the joint trajectories, and that we see that often children who are involved, as Anne said, like in perpetrating bullying, are also receiving bullying at the same time. And then these are children who might have difficulties like ADHD, conduct problems, etc. And so in a way, it's really important, as Anne said, to tackle both sides, because if you're able to help the perpetrators, then they might not do like not engage in this kind of cycle of bullying and being bullied, and that will basically help everyone. And yeah, so considering both sides is really important, and we might come back to the cyberbullying a bit later on also.
Thank you very much, both of you. I'd love to get your thoughts on this as well, Deepanshi. As your platform, you said, deals a lot with support for young people. Do you find that cyberbullying is something that comes up a lot? Is that the kind of thing that people support with?
Yes, actually, the discussions and that we were having here actually triggered a personal memory of my own, because I was bullied and I was also a bully. And I was a bully because I was being bullied, and I needed a space to vent out on someone that I thought was weaker to me. And I was projecting my insecurities onto them. And so I absolutely agree with everything that was discussed, that we have to look at both sides. The person who's bullying might actually be suffering from something that we don't know about, definitely. And in terms of my group, we get a lot of people who are being bullied at home, and they're in toxic households. A lot of young people are living in flat shares with random people who might not be very healthy to be around. So it doesn't have to be very, very young in schools. It can even just be people at uni trying to fit in. So I think it goes the whole way. Even as an adult, you can be bullied. So I think it's a really important topic to be discussed. Yeah.
Well, thank you for your honest experience share there. You're kind of mentioning already people are stuck in some quite difficult environments at times over the past year. Some people have been, obviously in very different situations. How have you found that young people have been managing their mental health?
Yes, absolutely. A lot of them are struggling in toxic households where their struggles are not being empathized with. Some of them, especially during the pandemic, they have been living alone. They haven't seen any people in months. And there's this feeling of being trapped and having no freedom or space from some of the people that they're living with. And many of them have used our support group as a safe space because they fear that if they share their feelings elsewhere, they might be judged. They might feel like their feelings are not being validated. And many of our attendants are also on the NHS waiting list for therapy, and some of them have been waiting for months and months and months. And as you can imagine, some of them, they've been waiting for 6 months, and a lot can change, a lot can happen in 6 months for a person, let alone in a pandemic. So that's a real concern, that we need to look at. Why is it taking so long, and what support is out there. And as many of you have already mentioned, that people feel afraid to speak up about these things. So actually having that support system at home, in schools, that's super important. Just anybody to talk to, that's really important.
Thank you. I can definitely relate quite a lot to that. I remember, so this was several years ago even, but I remember going through the kind of NHS sort of triage for mental health services, and I did several phone calls over the course of about a month. And after that, they said, yes, you definitely need to see someone. However, our waiting list is full. We can't even put you on the waiting list. So I know that can be a really difficult situation. We've heard a lot in the news and in the media over the past, especially about the impact on students and student mental health over the past year. I'd love to get your thoughts on that, as I know you are currently a student too, I believe.
Yes. Well, I think I have actually been quite lucky as a student because I've been studying from home, and I personally really enjoyed the first lockdown in March last year. Can't believe it's been a year already. It was a blessing in disguise, really. Suddenly there was no pressure to do or be anything, and you finally had time to do all the things you wanted to do. I really enjoyed that time. I had time to reflect on myself, learn more about myself. But that is just the introvert in me. I know a lot of my friends who are extroverts, and they have suffered a lot living alone in the city without friends or family, some of them stuck in uni accommodation. And, all my classes have been on Zoom. So that's not exactly what I was expecting when I booked my course. And many students like myself have been missing out on crucial life experiences right now. And I particularly feel bad for first year students who have probably dreamt of this time for years and have unfortunately it's been taken away from them due to circumstances. And I think this will have a very long lasting effect on them. And for me, I think this current lockdown, hopefully it will end in a few months. But even thinking about that, my anxiety has been on a high, and it has actually had a serious effect on my physical health as well. And, it might be too much information, but, like a lot of my symptoms are very visible. Sometimes I have to miss out on uni to actually keep them on the low, and, having heart palpitations, panic attacks, blotches all over my skin, and it's not something that can be explained right now. It's just something that happens due to stress. So yeah, it's a lot of up and down, but I particularly feel bad for the students that have been stuck in accommodation for so long, and it will leave an effect on them for the long term.
I can only imagine really what that experience must have been like, thinking to when I was at uni. It couldn't be much more different from the past year, really. So yeah, as you said, hopefully won't be too much longer. You might want to come back to a little bit more information on cyberbullying. Is there anything that you wanted to add on the effects of?
Sorry, Gemma, who was your question addressed to?
Sorry, that was to you. I just wanted to check. I know you'd said earlier if we wanted to swing back to cyberbullying before we move on to.
Yeah, so I think Anne said something quite important here. Like first, cyberbullying does have the potential to be damaging because it can follow children everywhere in a way, whereas normally bullying is like restricted to some places like school, where you might have, for some children, might have a kind of safer place at home or with friends, etc. And it also can be anonymous, which means that sometimes it can be even worse. However, in the studies that we've published and like in the literature in general, as Anne said, we see that cyberbullying rarely occurs in isolation. Often it is part of like a larger spectrum of experiencing bullying. And so I think it's really important because we've talked a lot about cyberbullying and tried sometimes make it something that is completely separate, but it's not separate from like dynamics that we also observe with bullying. And I think the kind of impact of cyberbullying seem to be also following the patterns of the impact of like bullying that is not cyber, that we've already discussed in terms of the mental health and having an effect of anxiety and depression. And so I think the main conclusion here is like, first, more research is needed because it's still a bit early in order to really understand the extent of the consequences and also the kind of predictors of cyberbullying. But I think a first general conclusion is that efforts to try to tackle cyberbullying should be considered a bit jointly with what is done to tackle bullying in general.
Yeah, that makes a lot of sense. I used to work for a cyberbullying charity once upon a time, and what you say is so true. It's kind of the difference between something maybe being at school and then you go home and get some kind of escape from it, whereas the online aspect, not only does it never leave you 24 hours a day, but you also feel like everyone else in the world can read it if it's something public on social media. So I know that can have a really big impact as well.
Yeah.
Anne, you have a new all-party parliamentary group paper, APPG paper, coming up on young people's mental health. Are you able to tell us a bit more about that and some of the key takeaways?
Yeah, so that's a piece of work led by the APPG and MQ, and it's basically looking at the impact of COVID and what's going to happen as, you know, post-COVID. And I guess what's important about that piece of work is that it brought together, you know, lots and lots of researchers that are working in children and young people's mental health, but also, and it brought them together with policymakers. And in lots of ways, that's where change happens. So one of the things that I'm sure Jean-Baptiste feels like me, that's slightly, you know, frustrating and when you work in research is like for the average piece of evidence to make it into practice and policy, it takes 15 years. So we have to get much better at getting our evidence out there so that it can make a difference quickly. And it's one of the ways to do that is that sort of partnership with policymakers. So I think this document was really important in that it did that, and a lot of it was about, you know, highlighting the importance of involving children and young people in anything that is being suggested, so putting their voices and needs central. There was a real focus on the socio-economic, you know, so the types of places and worlds that young people are living in and the poverty associated with that, and how we can impact on the environments that they're living in. There was a particular focus on parenting and nutrition. So we're coming back to all that prevention stuff. There was also a real focus on thinking about the data. You know, so one of the things that, you know, in the work that I do, that sort of data, if you collect, if you can measure things, you can make a strong case for changing things. If you can't measure things and you can't demonstrate to people who are either going to fund medicines or fund services, then it doesn't work. So there was a real focus on that. So that will be coming out soon. It also highlighted how little funding there is for mental health research. So if you there's so much interplay between mental and physical health, you know, that they interact both ways. The impact of mental health problems on physical health and, you know, the trajectories that we talked about are so huge and of equivalence to physical disorders. You know, if you look at there's a big world project called The Burden of Disease, and it's sort of, it'll sound silly, but it ranks what causes the most problems. And depression is right up there, ahead of many of the physical disorders in terms of the way it affects your quality of life. But the amount of research funding, I mean, I would add to that and money for services, but the amount of research funding for mental health is radically smaller. You know, really it's a scandal. And so this report does highlight that, you know, we need to be focusing on, you know, funding research to give the answers to the questions that we're talking about so that we can intervene early.
Yeah, absolutely. Thank you for that. And I think, yeah, that makes total sense. And hopefully with this paper and your data sets, that will make a difference. Sorry, Jean-Baptiste, go ahead.
Yeah, sorry. It's just to add to what Anne said, and it's really kind of humbling to see the impact of mental health on physical health. So, for example, a way of thinking about it and is that people who suffer from chronic depression during their lifetime actually have a life expectancy that is reduced as much as heavy smokers, and sometimes even more. And that's the case not only for depression, but for schizophrenia, etc. And so we all know that smoking is so terrible for your health, and there has been a lot of research into that type of medical research. But mental health is not only something that happens in your head, it actually has life, and here it's like really life and death consequences, and it's a major impact on life expectancy, and also like good life, basically the right to have a life that is fulfilling. And so it's really important to have research, because research hopefully will progressively give us better tool. But I will also want to emphasize the funding on services, because as Deepanshi said, there is so much like waiting lists, etc. That is also a scandal, and that's much more political question that us as researchers, we can advocate for it, but sometimes there is like a political side that we don't really necessarily like we can't act too much upon, and is also really important in terms of funding services.
And like trying to, you know, I think that imbalance for services and research is historical and really rooted in stigma. And I think it's, you know, there's lots of work to do to rebalance that. I do think things have changed a bit. You know, sometimes you feel like things have changed a lot, and then something will come along that will remind you that actually it hasn't changed as much as you thought. But it's really important.
Definitely. I'm going to jump in there because I've got one eye on the time, and I just want to ask each of you before we move on to the Q&A section. So if anyone in the audience, now's the time to get your questions in the Q&A box while we just finish up. Before we do that, I would like to ask all three of you, what can young people do right now to look after their own mental health? And for me and anyone else who's watching who wants to help to support young people in their mental health, what can we be doing at the moment to support them in that? If we could start with Jean-Baptiste.
So I think actually the two of the panelists will be more qualified on that question. And like here, it's fairly simple, like in a way, given the circumstances, I think we have to be a bit kinder to ourselves, and then also check with not only ourselves, but other people to see where they are in terms of their mental health, and try to flag if there are any resources. So as we talked about, like the services are unfortunately like so behind the needs, but there are still some resources like helplines, or maybe talk to your GP, although, I mean, again, you probably will be referred to waiting list. But for some group of people, for example, for students, they are often local additional help from universities. So like not as a researcher, but as a professor, I have contact with many with many students, and a lot of them have been struggling a bit this year. And so each time I try to flag up, like to signpost what are the resources that are available locally in the university to help them. So basically be attentive, and then try to be aware of the resources and signpost them when it's possible.
I think
Thank you. I know that's true a lot of universities, so that's a good one to remember. Anne, did you want to jump in?
Sorry, I think I did jump in. Sorry. I guess one of the things that's been really difficult this year is for young people, I think in particular, to understand, you know, what's a normal reaction? When do I have a mental health problem that I need to seek help for. And then when you combine that with everything that was happening with services and protect the NHS and everyone being so stressed and fear of COVID, I think a lot didn't seek help. And I guess it's raising that awareness that, you know, this has been a difficult time, and that will have affected the way we feel in ways that will go up and down. But if the way you feel is beginning to interfere with your sleep or your schoolwork or how you go about your day-to-day activities, then you should seek help. And as Jean-Baptiste said, that help can come from lots of different places. But it's really important that you do seek help, whether it's from speaking on a crisis line, talking to a friend, approaching your parents, or approaching people from school. That first step is really important. And I think that was the case, you know, because when we have to talk about the lack of services because it's a reality. And we do it because we want those services to be there for people. But I think sometimes that can make people feel like there's no point in looking for help. And so I just think it's really important that you can get help from lots of different places. And, you know, recognizing when you've really reached that place, when you need it, is an important thing for young people to know.
Yeah, I would agree with that as well, for sure. Deepanshi, lastly, would you like to add anything on what young people can do for mental health support right now, or how we can help to support?
Yes, I think if you are a young person listening, please be gentle with yourself. You have survived a pandemic, and that's an achievement on its own. And I think it's really important to just listen to what your body is trying to tell you. You have to be the first person to validate all the feelings you're feeling. Only after you acknowledge them, can you actually decide what to do with them. And I think, you know, don't hesitate to ask for help and vocalize what you need. It's perhaps the bravest thing you'll do, but it's just the first step. After you do the first step, it gets easier. And I think if a young person is reaching out to you for help, asking you for support, please listen with your full attention. It takes a lot of courage to be vulnerable like that, to speak up, and they're putting their trust in you. So yeah, please listen, because it's a real honor that they're giving you right now. Yeah.
That's such an important point. Thank you very much for that. So I am going to move us on to the audience Q&A section. Bear with me 1 second. I know that Daisy from MQ has been monitoring your questions, and she is sending them over to me. So bear with me 1 second. So I will start with a question from Margaret for Anne. And she asks, is suicide data among young people collected? And from this, is there any clear view of causes of suicide among young people?
So data is collected. We only really hear about it a year later, and that's because of the need for inquests. So it's very difficult. It has been quite difficult to know what's happening in the UK at the moment. But there was a study done in England, and they worried there was a concerning signal at the beginning, but actually it looks like suicide hasn't increased in young people during the pandemic. In terms of understanding the reasons, there are lots of risk factors associated with suicide, and we've covered a lot of them. You know, there's maltreatment and abuse. It's much more common in deprived communities. But being in a family where there are suicidal behaviours, bullying, all these things. You know, there's a whole list of factors, but it's that thing with mental health in that 1 + 1 doesn't equal 2. And so, you know, in the way that Jean-Baptiste talked about how we can, you know, reduce bullying by 20%, but then the complex interplay of factors on people's mental health, that's very similar to suicide prevention. And I think one of the main things is ensuring, so one of the biggest risk factors is self-harming behaviours. It's important to say that self-harm is relatively common in younger age groups, whereas suicide in young people is relatively rare to other age groups. So, you know, but people who self-harm, you know, you almost need to do, it's what we call it a psychosocial assessment. But what a psychosocial assessment is finding out from that young person, what are the factors that are making them feel like that? Is it relationships? Is it family? Is it things happening in schools? And then doing something about it. And I think recognizing that, you know, when young people tell you about these things, it's actually taken them a lot of courage to do that usually, because these are usually very, very hidden things that they're often quite ashamed of. And even if you don't feel like you can solve any of those problems, just responding in a non-judgmental way and having an unhysterical conversation can work wonders and will make them much more likely to seek help again.
Thank you very much. This is a somewhat related question, so I'll move on to this next. Question for Anne and Jean-Baptiste from Emma. And she says, I'm a PhD student looking at bullying victimization as a risk factor for adolescent self-harm and working with data from a cohort study based in South London schools called REACH. I wonder if your work has looked at both bullying and self-harm together and the potential causal relationship. So I'm not sure if one of you wants to jump in there.
Yes, so we have not looked at it very specifically, but work has been done, and like the same type of studies that I was talking about, twin studies, and it does suggest that there is an effect of bullying victimization on self-harm and all the kind of spectrum of suicidal ideation and related difficulties. And in a way, it's kind of follow from what we've said about the role of bullying victimization on anxiety and depression, because anxiety and depression are kind of major risk factors for self-harm and suicide. And so, like, because bullying has an effect on these, then you kind of would expect that it also has an effect on self-harm. As I said previously, like self-harm, and Anne also pointed to that, is a very complex set of difficulties, and therefore is multifactorial. So bullying victimization might be very important, in particular for some people, and then for some others might not, like other reasons, like will have to be found. So that's actually more in general the complexity of research with mental health is like there is quite a lot of complexities, and therefore we can't focus on just one risk factor, and we have to take into account this complexity to try to intervene the best we can.
So I sent, I think it's Emma, a review that we did looking at this issue, looking at lots of studies that have been published. And one of the issues in this area in particular is that lots of the studies are what we call cross-sectional. They're sort of snapshots, and they look at relationships like you've got small feet I can't remember what the link was. You have a big vocabulary. So they're like snapshots, and you can see spurious associations. So what you want is longitudinal studies where you follow people up and see what happens to them. And I think, but if they're not big studies, then there aren't enough people that you can see what happens to them if they have these risk factors. So I think there are studies coming out that are big and longitudinal that are exploring this issue more clearly. It's quite hard as researchers to keep up with the online environment because it changes so rapidly. So, I've got quite a big gap between my kids. And my eldest used to be on a thing called Bebo that my youngest has never ever heard of. So it's very hard to keep in the spaces where you can do this research well. We did a piece of research looking at if how long you spent online affected your mental health. And the question that we were looking at was talking about, TVs and laptops, not TVs and computers, not laptops and phones. So it's the modes, the mediums, the way people are working online. It's not an easy field to stay current in.
I'm going to move on. Again, I feel like this question slightly leads in and sort of alludes to what you were talking about earlier, Anne. Someone has asked a question and said, would love to know if panelists could share some of the reasons why people don't want to participate in mental health studies.
I don't think, I'm assuming this relates back to what I said. I don't think it's always that they don't want to take part in studies. I think that when you have depression or anxiety or schizophrenia or other mental health issues, it's a challenge to take part in studies. So some studies, you have to take part in a 2-hour interview. That's actually really, really hard work. And so I think people want to, and there is work out there that shows that people actually get something out of taking part in research. But I think it's very challenging. And then I think if you're ill and someone wants to, in some of the studies, we'll come back to someone after a year, you may not be in a space where you want to do that again. So I think it's much more about being ill in the same way that, if someone was in the middle of an exacerbation of some sort of physical illness, they might not want to.
I think I would say from my personal experience, what I have had an impression of research and things like that would be that, there's always this fear that you wouldn't be human way almost, as in it's very scientific, very academic, and as of course mental health is very emotional. It's a lot to do with your feelings and what's happening with you inside, and I think there is this fear that you will be out there with all your emotions, all the things you're struggling with, and you will not be received in an empathetic way. So I think, and this is something that a lot of my attendants, my support group attendants, have shared with me, that their experiences in other environments where they have shared their feelings with professionals or in a scientific way, and they haven't been received very in a human way. But these their experiences are very old, many years old, so I'm sure a lot has happened and a lot has developed in these recent years. But I think it might even just be, I think it is a misconception that I think needs to be cleared up, so more people can open up and actually talk about it and be open to going to this research. Yeah.
I mean, one of the things that we're all trying to do, so we're doing it in Swansea, but I'm sure they're doing it as well in UCL, is also involve young people in research from the start. So in sort of deciding what we're going to do, but then also, you know, I'll have interns on my team and things. It's so sort of trying to address the barriers that you're talking about, that actually research is about trying to understand. It's not about being, you know, scientific sounds standoffish, doesn't it? But it's not. It's not that. It's really trying to understand why things happen and for what reasons. And if it ever feels like that, it's almost like we're trying to, you know, all the things we talked about, all those different factors. I can see my dog's beginning to get restless. All those different factors, it's trying to understand those. I'm going to be quiet now and mute myself.
No,
It just wouldn't be a Zoom call without some kind of child or pet, would it?
oh, sorry, I interrupted you, Gemma. I completely understand what you're saying, and actually, I think the problem is that there has been years and years of this misconception through social media and movies, even, of how research is conducted on individuals having mental health struggles, and that kind of is so difficult to get rid of. And I think what you're saying is amazing, and I hope that more people, after listening to you, can open up to it and, you know, actually get rid of that image of, no, it's much more human, and, you know, things like that. Definitely.
Thank you very much. I think if we move to, this is quite a practical question from Paula, who asks, as a school governor, what can I do to make sure that mental health and well-being is a high priority? Well, John, take that. Sorry, I didn't direct that at anyone.
Do you want to go first, Jean-Baptiste? Yeah. To make it a priority, one of the things that we're doing in Wales, and it was advocated across the board, and you're also doing it in England, is to make mental health part of the curriculum and take a whole school approach. So, you know, there's part of having it in the curriculum so the conversations happen. There's making sure that teachers and other professionals in school feel equipped. You know, nobody's expecting teachers to become mental health professionals, but they should feel equipped and trained to be able to signpost and refer, and when I say refer, you know, have systems in place so people know what they should do if a young child approaches them with certain problems. And I think when teachers and other staff are trained in that way, most of them will do it very naturally, but it can be uncomfortable for others. And if you have those systems and processes in school, people feel comfortable. One of the things we see in self-harm a lot is that because it's so stigmatized, because people often feel like they don't know what to do, it's often easier to ignore. And so I think it's having those processes in a school, creating a culture and environment where people can talk openly for boys and girls and staff. Those are the important ways. And then having resources freely available in school. You know, there's so many resources out there, and you know, every local authority will have some system to signpost schools to what resources they recommend. And you know, it's having those at hand for people to deal with, and then having wellbeing services.
Great. I also put in the chat a link to the Anna Food Center. So it's a charity that does a lot of work with young people, and they have a specific link with resources for schools and mental health. So that would be a good way to maybe start exploring.
I would also highly recommend doing a mental health first aid training for schools. Just having even one person in the staff team to look out for worrying signs. And yes, of course, it's so important to be emotionally available when a child approaches you. But sometimes it's very scary to even be approached, and to be able to look out for those little signs here and there. If someone is being bullied or is a bully, for example, if we know what signs to look out for, we can kind of try and tackle that situation early on before it gets too serious.
Thank you. I'm going to put one last question to all three of you, I think, and then we might be out of time. Question from Joanne, who asks, COVID aside, why do you think there is such an increase in mental health issues among young people? Or is it the same as before, we just have better awareness now? Deepanshi, if you'd maybe like to start with that one.
Yes, I think it is just more awareness. I think the mental health struggles have always been there from generations and generations. It's just we have become more open and talking about it, and I think that's great. Finally, we're talking about mental health, and I think it's really helpful for us to continue being more vocal about our struggles mentally as we are with physical health. And yeah, I think it's the same. I don't think it's something new that's turned up. It's just we're talking about it more. We're opening our minds to it more.
So it's an interesting question, and it's really quite still a bit debated. So there is some evidence when we look at studies that have been done like 10 or 20 years ago and now, that in some cases there is an increase, but it's really hard to say whether it's a true increase. And my inclination is more like what Deepanshi said, is like because people are more open about it, they will more likely respond that they are experiencing these symptoms where they might have brushed it off like a while ago. So the truth is that there is a bit of signal that it might be increasing, but it's really hard to say. And I think it's fair to say that like mental health struggles have existed for a long time, and they might change a bit in nature sometimes. So for example, the cyberbullying obviously was not there previously. So to some extent, they might change in terms of what is experienced and the particular nature, but it doesn't mean necessarily that it's increasing, and definitely not like increasing very massively, I think. Now, Anne might have like a different opinion on that, but yeah.
So I guess if you'd spoken to me a couple of years ago, well, we were predominantly looking at increases in contacts with services. So there was an increase in admissions for young people with self-harm. I would have said that. I would have said, well, actually, we don't know. Is it that awareness has increased, so people are presenting to services more, and have we got better? So the guidance about how you look after someone, a young person under 16 who's self-harmed, is you admit them. And I would have gone, have we just got better at actually doing the right thing so we can count better? But I think there is reasonably good evidence now from surveys, well-designed surveys that are repeated, that particularly for older adolescents, anxiety, depression and self-harm have all increased. Why that is really difficult to unpick. So the easiest thing for us all is to think about cyberbullying and social media, because it's such an obvious change in young people's circumstances. But there are lots of complex factors. I'm sorry, I've got teenagers just not getting their keys. And you can think about things like, levels of poverty and recession. So there's been increases over the last decade. Is it about that? Are there changed academic pressures? And I think this is one of the things that as researchers we're really, really trying to understand, isn't it? It's a really important question. I'm going to let them in now. I will go back.
Yeah, so I think, as Anne said,
Okay.
there is still a kind of discussion about the evidence, and you will have some kind of fluctuations. So, like for example, the notion that economic crisis can lead to an excess in self-harm has been observed time and time again. So there will be like increases, and it's, I mean, totally possible, as Anne was saying, that like some fairly recent changes will have effect to some aspects of mental health, in particular self-harm.
Debated topic, so I could be wrong. It's debated.
Well, it goes to show clearly more research is needed into that area for sure. Thank you so much, everyone. Thank you, everyone on the panel this evening. I'm aware that we've gone slightly over time already, and I've seen a few people having to drop off. So thank you very much for having me and having us. I'll just pass over to Daisy to do some MQ housekeeping and provide you with a bit more information on some things coming up for them. And thank you.
First of all, yeah, thank you to our amazing panelists and wonderful host Gemma. So you can follow MQ on social media at MQ Mental Health. Would you like to all quickly go around and share your social media handles so people know where they can follow you? First to unmute.
I've just posted that in the chat.
Oh, brilliant.
And Anne too.
Oh, Anne as well. Perfect. So share those on there. And also just to say that I've shared a link earlier to our MQ Mental Health Science Summit that is coming up in May on the 12th and 13th. We'll also be discussing young people's mental health. So come along. It is the event in mental health research. So make sure you come along and hear wonderful speakers. And it will be really fascinating. Also, we are a charity. So we do rely on generosity of the public to fund the next mental health breakthrough. So if you feel like you're in a position to be able to make a donation, please consider doing that. I will share the donate button here. Other than that, thank you so much. This has been so amazing and fascinating, and I've been struggling to tweet because I've just been so enthralled by the conversation. And so thank you so much, you wonderful guests, and thank you for everyone who's come along tonight, and have a great evening.
Thank you all.
Thank you.
Lovely to meet you.
Bye.
Bye.